Let us talk about the biochemical mechanisms underlying Ayurvedic interventions. So, Ayurvedic remedies and practices offer benefits through a variety of biochemical pathways. Recent studies have demonstrated how these interventions align with the modern understanding of metabolic syndrome pathology. And this includes the inflammation, oxidative stress, insulin resistance, and dysregulated lipid metabolism. Let's first talk of the anti-inflammatory effects. Chronic low-grade inflammation is a hallmark of metabolic syndrome. Ayurvedic herbs such as turmeric or curcuma longa are rich in curcumin, which inhibit the nuclear factor kappa beta, NFKB, a key regulator of the pro-inflammatory cytokine. The other herbs like guduchi or Tinospora cardifolia moderate and modulate the immune response by reducing the level of C-reactive protein, CRP, and interleukin-6, IL-6. So first was anti-inflammatory effect. The second effect is antioxidant effect or antioxidant property. The oxidative stress plays a pivotal role or important key role in pathogenesis of insulin resistance and cardiovascular complications in metabolic syndrome. Polyphenol in amalaki or Emblica officinalis and catechins in tulsi or Ocimum sanctum neutralize free radicals and upregulate the endogenous antioxidant systems, including the superoxidase dismutase or SOD and glutathione peroxidase or GPX. Therefore, the amalaki and tulsi are both effective in reversing some of these undesirable antioxidant effects. The oxidative effects and these antioxidant properties reverse this mechanism and improve the metabolic syndrome and the obesity. The third effect is improving the insulin sensitivity. So Ayurvedic formulations containing methi or fenugreek and Vijayasar, which is also known as Pterocarpus marsupium. These both methi and Vijayasar enhance the insulin receptor sensitivity. Active compounds such as 4-hydroxyisoleucine and pterostibiline, they both are shown to activate the insulin-resistant substrate 1 or IRS1 pathway. And these promote the glucose uptake in the peripheral tissue and therefore reduce the risk of the metabolic syndrome, diabetes, obesity, etc. So we talked about first the anti-inflammatory effect of some of the herbs, which included the turmeric and guduchi, and I think also, mainly guduchi and turmeric. The antioxidant effect of amalaki and tulsi, and then we talked about methi and vijayasar, which have effect on increasing the insulin sensitivity and effect on the insulin receptor substrate V or IRS1. The fourth one, we talk about regulating the lipid metabolism directly. And lipid imbalances are central to the metabolic syndrome, as we all know. And therefore, the herbs like gugulu, which is Commiphora mucul, enhance the LDL receptor activity in the hepatocytes or liver cells, and this lead to increased clearance of circulating LDL cholesterol. Therefore, the LDL cholesterol decrease. In addition, Arjun or Arjunalia terminalia reduces the triglyceride level by modulating the peroxisome proliferative activated receptor alpha. It's a long name, PPAR alpha as it is called, and that in Arjun is known to reduce the triglyceride level. The fifth one is gut microflora modulation. So gut microflora or gut microbe or gut bacteria are now known to be important key player in metabolic health. Ayurvedic treatments including Triphala are prebiotic in nature, and these foster the growth of beneficial gut bacteria such as Bifidobacteria and Lactobacillus. And this improves the gut barrier integrity and reduce the endotoxemia associated with inflammation, which is known to increase the metabolic syndromes. Then we talk about the clinical evidence supporting use of Ayurveda in metabolic syndrome. So let's first talk of Triphala. A placebo-controlled study of 150 patients with metabolic syndrome demonstrated a significant improvement in waist circumference, HDL cholesterol levels, and fasting glucose after 12 weeks of Triphala supplementation. The findings indicated reduced marker of inflammation and oxidative stress, and these correlate with the clinical outcome. Second is yoga and pranayama. A systematic review of 25 studies highlighted the effectiveness of yoga and pranayama in reducing BMI, fasting glucose, and triglyceride levels in patients with metabolic syndrome. Yoga improved stress markers such as cortisol levels, supporting the role in mitigating the stress-induced metabolic dysregulation. Panchkarma. So we talked about Triphala, we talked about yoga and pranayama. Now we talked about Panchkarma. So these are all scientific support. A multicentral trial of Panchkarma therapy revealed a reduction in HbA1c, which is indicator of diabetes, LDL cholesterol, and waist to hip ratios among 100 patients undergoing detoxification protocols. The study concluded that Panchkarma not only alleviates metabolic dysfunction, but also enhances the mental well-being. So we can say that there is significant benefit of a variety of these components. Then we talk about the future. Therefore, the standardization of the Ayurvedic formulations will help in making these acceptance of the Ayurvedic herb in the clinical practice, and analytic techniques such as high performance liquid chromatography HPLC should be employed to ensure the consistency and efficacy. The second is also advanced research employing the omic technologies, which is genomics, proteomics, and metabolomics, can show or demonstrate the molecular mechanisms of the Ayurvedic therapies and bridging the traditional knowledge of the modern science, and therefore increase the acceptance. And the third is robust randomized controlled trials with large sample sizes and longer follow-ups are needed to establish the efficacy of the Ayurvedic interventions in managing the metabolic syndrome. And lastly, the collaboration between Ayurvedic practitioners and modern medical professionals can foster the integrative approaches, and policies promoting the Ayurveda as adjunct therapy in the national healthcare system can increase the patient improvement. I can just say that Ayurvedic medicines offer a holistic, evidence-based approach to managing the metabolic syndrome by addressing its root causes and improving the overall health. Although the anti-inflammatory, antioxidant, and metabolic benefits are very well established, Ayurvedic complementation of the modern treatment, providing an integrative framework for chronic disease management, is still needed in order to increase its acceptance. A continued research and stabilization will increase its credibility, enabling the broader adoption and improve patient care.